guys. Happy Saturday. Welcome to Dr. J's Prescription for Health. I'm your host, Dr. Malea Jensen. This is your opportunity to ask questions, ask medical questions, and start to figure out what are some things that you can do to improve your own general wellness. As a disclaimer, this is for information purposes only. This is not medical advice. And there might be a little entertainment in here, but for sure, just information purposes only. I want to, good morning, you guys. Diane, good morning. And Eddie and Jana, good morning, you guys. Who wants to lead off with one of their questions? Does anybody have any questions? I am live. Let me see. Hold on here. I am live on YouTube and Instagram this morning. Good morning, everyone. Okay, while I'm waiting for your questions to start piling in, Ruth says, bamboozled with buffoonery is always entertaining. Come to think of it, Ruth, I had one of my listeners, one of you guys out there, who sent me some logos regarding the buffoonery and the bamboozlement. They were very cute, and they are good ideas to think about whether or not I want to put them on some apparel, and I will let you guys know. We're basically working on maybe some color schemes and changing it up just a little bit. So I want to thank Jim for that. Angel says, good morning. Good morning, you guys. If you are on Instagram, there is a live fundraiser going on for rescue, rehab, and rehome. I want to thank people who just recently added to that fund. My goal is $100, and I'm halfway there right now. Again, that is a fundraiser that means a lot to me because that's where I got tallow. And so far, I have seen very good things out of this rescue, and I feel proud that to sponsor them myself, as well as to have or ask you guys for small donations as well. So good morning, Denver. And it's Kathy. Hi, Kathy. I still like to call you Angel because that's what your handle is. One of the things that I want to talk about this morning, and you guys can jump in. Hold on. I guess we got a question coming in. Buenos dias, says Lucy. I'm off chemo for a few months. How do I strengthen kidney health? I think drinking good water, getting exercise, good blood flow, watch your blood pressure, keep your insulin levels low, which means keeping a low carb diet, eating healthy ruminant meats and fat, getting sleep, getting out in the sun, all the things that I would tell anyone in order to stay healthy. But Lucy, I want you to focus more on your kidney function not going down. If it stays stable, at least it's not going down. So that should be our main focus, is not to have it go down even more. Forever Cowgirl asks, what causes high blood pressure on mostly meat, eggs, and butter? Tell me what high blood pressure is first and foremost. And then also tell me how much salt you are consuming and how much water you are consuming. We are, let's see. Let me see. I'm trying to read the questions over here on YouTube. Denver, I agree. The age of the kidney would be a factor, but I think that Lucy is midlife and she's got a lot of life left in her. So I would agree the age of the kidney, but hers is, I think, in good shape and easily, I think, can recover. Living Bread from Heaven says, like, comment, and subscribe. You are all great and you all matter. Stay blessed, folks. Thank you for that. I do appreciate it. It's hard for me to ask sometimes to, if you like my information, please like and subscribe. It helps me and it helps other people who might have questions that are not getting answered by their healthcare provider. So I'm just here to provide some information. Even if the information that you know that I'm giving, if you think it is wrong, it gets you to open up your brain, open up your eyes, and start looking into some things that you look it up for yourself. And I think that's important. Hey, hold please. Go lay down. Let's see. Chris says, I drink nothing but Dr. Pepper Zero. I don't know if that's a question or just making a comment. Evelyn, thank you for liking and subscribing. I appreciate that. Denver says, Denver's trying to help me out over here on YouTube to answer Jana's question on Instagram. And the reason some people get high blood pressure, it would be stiffer arteries, increasing plaque, and increasing sodium in the diet. Denver, this is a person who I believe is, lay down. Lay down now. Thank you. They are a person who is carnivore. So that is things to play into consideration. Hi. I got Tallow here. I think he heard his name, so now he doesn't know what to do with himself. So to answer Forever Cowgirl's question, we'll wait until she gives us a little more information. Ruth says, I'm thinking lately about how well a body heals, even if it takes time. I agree. We've likely been damaging our body for years, and it's going to take time for it to heal. But to go through that journey is exciting. For me to go through that journey with you, Ruth, is even more exciting. So keep sharing and letting us know how things are healing in your life, even if they're just tiny little things that, you would think mean nothing to others, but they really do, because they're important for everybody. Good morning there, Jim. I appreciate you being here. Forever Cowgirl says, okay, I think I need more water and salt. That's a possibility. If your blood pressure, again, yes, the age of your arteries does matter. If they're stiff, if they're full of plaque, getting a calcium scoring test would be in your best interest if you haven't already done so, just to see where you're at. And remember that it is not the carnivore diet right now that is causing your high blood pressure. It's from years of you not following the carnivore diet and likely developing instances of high blood pressure. So as you're new to this game of carnivore, it does take time for your blood pressure to come down. But I want you to consider one other thing, and I don't know if this is, it's just one of those stop and think things, is stop and think that your blood pressure is a protective mechanism. And it will go up when it senses that vital organs need blood. So say your brain. So if your pressure is low because of your diet, say, your blood pressure will go up thinking it needs to get blood to your brain. So your pressure is a natural protective mechanism to increase that blood flow to your brain. If you are not drinking enough water and you're not consuming enough good salt, mineral salt, you could see where your blood pressure would drop. You get orthostatic. You might feel that whenever you get up from a sitting or standing position, your blood pressure, you get dizzy. So that means your blood pressure is low. And then in order to get your blood pressure back up, in order to get blood to your brain, your pressure might take a rise. Also, how are you taking your blood pressure? When you take your blood pressure, you should sit quietly for about 20 minutes. Your feet should be flat on the floor, not with your legs crossed, and you should at least empty your bladder a time before that. So an empty bladder, sitting for 20 minutes calmly, feet flat on the floor, no talking, so no conversing, and then take your blood pressure in this state. That is the proper way to take your blood pressure. You also want to at least have your arm at heart level, okay? So if you're taking your blood pressure with an automatic cuff, just put your arm up on the table after, while you're sitting for 20 minutes, feet flat on the floor, calm, empty bladder, not talking. Okay, hopefully that helps. If you have another comment, let me know and we can talk about it. Ruth says, what are the causes of toenail fungus? Well, what do fungus eat in order for them to survive on your toenails or on your skin? And my first thought goes to, what is your blood sugar status? Are you a diabetic? Because in diabetics, fungal and candidal infections are very, very common. And that's why toenail fungus, and plus it's very hard to get rid of them, okay? You could leave them in a status quo, you could be eating carnivore and they could be status quo, and any amount of sugar that you consume just as maybe a cheat feeds those fungus. So likely those toenail fungus need to be treated, and they might not just go away simply by eating a carnivore diet. They will use any sugar they can to survive. But also iron status is another thing that I like to talk about. Fungus not only eats sugar, but they consume iron, as do all pathogens. Viruses, fungus, bacteria, they consume. Thank you. There's RM, and RM is my moderator. So the ones with the little blue wrenches beside are my helpers. They're my center stage helpers, and I appreciate them. So if you are being naughty and not so nice, RM has been given the go ahead to dismiss you from the live stream. And if you want to remain in the live stream in the future, you need to play by the rules, and the rules are, this is for medical purposes, for information purposes only. We discuss medical stuff. We don't really discuss much else. So if you have a question in regards to your medical concerns or exercise or nutrition, I'm all for it. But if you want to talk about other things that are irrelevant, especially for this time, they might not be irrelevant in general, but just for this time when I'm spending with the listeners in regards to their health. Okay, so RM, I'm going to help you out here. There we go. Arshi is listening from India and is a big fan. And Peter, I do not speak German, so something about a friend, I don't know. Let me see. Yeah, I'm sorry, I don't know German, but here's a question. If I have Bell's palsy for 2 years, is there any chance of it going away? I think there is. I think there is a chance to decrease the inflammation on that nerve to allow it to have some breathing room. When the pressure's off that nerve, the inflammation is off that nerve, then I think there is a chance to heal. I think you should look into your labs. There we go. We're going to get rid of some others. Here we go. Grid Lad, thank you. I appreciate that. Or, oh, geez, Girl Dad, sorry. Oof. I am able to read, but thank you. I appreciate that. Please hit the like button and subscribe if you haven't already. I appreciate that. Good morning, Lion. Where was I? I get lost in my thoughts sometimes here. Here's a question. My husband had a physical this week. His doctor tried to prescribe him something to treat it. My husband had a physical this week. His doctor tried to prescribe him something to treat it. What is it? I think it's hard on the liver. I told him to decline that, and we will get some oregano oil. Oh, toenail fungus. Okay. Give it a try. I don't know much about oregano oil and toenail fungus. I've even had people who have told me they've treated their toenail fungus with borax in their socks. So I don't know. If we have a few dumbbells and free weights at home, is that sufficient, or do we need a gym? You do not need a gym. If you have dumbbells and free weights, I think that you can make a very good opportunity for doing resistance training, okay? So if you would like help with an exercise routine, you can go to help with YouTube and, tell them, or, put in what you have available at home, put that into AI and ask for a routine for every body part. So that would be a start. And it would you could, have a routine that is printed out for you from AI. I think a lot of people have probably done that. I had my blood pressure taken 3 times at a natural dentist appointment, 150 over 130. That seems a little odd to me. And then there was another cuff at 130 over 100, 15 minutes or so later. Still concerned. I would take, you do have mouth bacteria? Of course, we all have mouth bacteria. We all have mouth bacteria. Some are good bacteria, some are bad bacteria. So finding out that you have mouth bacteria does not surprise me. However, if you are a person that gets worked up at the dentist, finding out that you have mouth bacteria, which can be normal, you might have a rise in your blood pressure. So I suggest that you take your blood pressure at home on different occasions. Bell's palsy labs, I don't know what you're meaning by that. Medi says, hello, doctor. First time on this channel. Can I know about you? Love from India. Hello. I am a family practice physician in Iowa. So I'm in the United States. I'm in Iowa, and I've been practicing for over 25 years. And yeah, that's what I am. That's what I do. I also do online consultations, in case you weren't unaware. So if you have a need for a consultation with someone like myself who can help you review your labs, review your medical history, give you some information so you can take back to your personal doctor, I act like a helper in your back pocket that you can have available that will help you talk to your doctor about things that you might not know, to bring those things up to your doctor. So, yeah, that's what I do. So if you want to consider a consultation, email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. TX Clark asks, is it true there is relationship between untreated mono and MS? That I do not know, but mono is suggestive of a viral infection. It could lay dormant in our body for years. MS, I have thought about this on many occasions. Any neurological condition, Parkinson's, seizures, MS, depression, anything that overwhelms our neurological system, you got to think about even the Bell's palsy. If our diet is very inflammatory, if we're eating a lot of carbs, a lot of sugar, if we're insulin resistant, if we have a lot of trapped non-heme iron that's not absorbable, we are going to have problems neurologically, and things need to be looked at from a deeper perspective, and I'm not sure that we are doing this. Forever Cowgirl says, bad bacteria, I will be addressing that at our next appointment. Okay, let us know, keep us in the loop. Bad bacteria is a lot of times related to our gut health. Our gut health is very important. So improving our gut will improve the bacteria in our mouth. Also, the types of toothpaste we're using as well can play a role. Akil says, could you please advise me what to do? I always have pain in my muscles, bones, joints, despite medicine and exercise is no relief. even when I wake up in the morning having sufficient sleep. I think, Jill, that, you need to discuss these things with your physician, but I think getting a baseline set of labs and looking at your medications, your diet, your lifestyle in general, is very important to get a handle on it. But just giving you any advice, that's what I don't do. I provide you with education, and then you use that information to help you. A question from our moderator, our Blue Wrench. Dr. Jensen, what are your prices for consult and follow-ups? My consultation is $110 an hour, and that's straight across the board, whether it's a follow-up or not. B1, I do not know enough about EMDR to comment in regards to your neurological concerns. Vance, thank you very much. I appreciate that. Hold on, please. You guys lay down. Tallow, lay down. Thank you. Yeah, Denver, we should probably just provide information to Agil and help that way. I do appreciate you wanting to extend help. Okay. Forever Cowgirl says, does oil pulling for teeth help as claimed, and would olive or coconut oil be best? I would assume coconut oil, which is a natural antibacterial, but again, I don't know enough about oil pulling as a treatment. I don't think it would be hurtful to you to incorporate that as part of your dental routine. But overall, for Forever Cowgirl, from my perspective, I think routine cleaning is the most important thing. So you might be a person who needs to have more frequent cleaning, like every 3 months, because you build up tartar, and tartar on the teeth is, will produce bacteria or attract bacteria. And so it's not uncommon if that you have tartar, you're going to have bacteria. Not all the bacteria in our mouth is bad, and we don't want to start using disinfectants to try to get rid of the bad bacteria. We want to improve the good bacteria. And so I would recommend more frequent dental appointments where you're getting deep cleaning and cleaning your gums from the, of the tartar that's building up. Okay, hopefully that helps. If yes, comment and let me know if that helps. Nancy asks, any ideas for chronic piriformis syndrome and tight calf with metatarsalgia? I don't know where to start. Walking 4 miles daily. Well, Nancy, who diagnosed you with chronic piriformis syndrome? If you guys are not aware, the piriformis sits in your butt area, and it is a muscle when it gets inflamed, will squeeze on the sciatic nerve. And that sciatic nerve, which comes out of the L5-S1 area, can be strangled. And then when that sciatic nerve is pinched at the source of where the where the piriformis is, it can be painful in that area of the piriformis, and it can also radiate down your leg on the side that you're having the piriformis syndrome. It is very important to stretch your glutes and your hamstrings and allow that piriformis to relieve itself. For right now, I would stay away from NSAIDs. I mean, I don't know how long this situation has been bothering you, but getting appropriate physical therapy, and stretching. I'm not big on massage or using a ball therapy if you're having extreme problems with or acute problems with that piriformis squeezing on your nerve. Because the more you push on that area, you're going to irritate that nerve even more. So I'm not that, pushing, using a ball to push on that piriformis area or some sort of deep massage could actually exacerbate your problem. You might need to take a break from your walking. It might be your shoe gear, the type of shoe gear. It might be your gait, your heel and strike, the way you walk. It might be whether you walk in a supinated or a pronated position. So looking at the bottom of your shoes. A good physical therapist will be able to acknowledge these things and help you deal with, hey, is this just a posterior chain problem? Maybe it started from your back and then you've compensated because of back pain. You walk differently and now your glute activation, so your buttock activation is causing that piriformis to be highly inflamed and highly active. He's trying to do a job that maybe he was not meant to be. So he's getting inflamed, and in the process, he squeezes on that sciatic nerve. And then that sciatic nerve makes you walk a little bit oddly. And then that can radiate to, hey, I got a tight calf. Hey, I got metatarsalgia, means the bones, the long bones in the foot are giving pain. Algia means pain of the metatarsals. So in case you guys don't know what these terms are that I'm reading that Nancy's very familiar with, but maybe backing off on the walking, stretching those glutes, stretching your low back, going to a stretching clinic might help, going to a physical therapist might help. I'm guessing, Chaz, that's the, what, you know, we're talking about piriformis, so I'm guessing that we're also, in relation, we're also talking about the sciatic nerve. Okay. Okay, so help out with the terms. Okay, so Nancy was asking about the piriformis. The piriformis is actually a name of a muscle in the butt, okay? And she talked about having a tight calf, and she's also talking about foot pain. So her foot pain, she wonders if it's all connected. I think it could be all connected, that her tight muscle in her butt is squeezing on a nerve, and that could be radiating down her leg, or it could be encouraging her gait to be off kilter. And when her gait, her walking is off kilter, she puts a lot of pressure on her feet in areas where she never had pressure before. So changing the shoe gear, maybe backing off from any walking right now, can help. So if this helped you, Nancy, please let me know. Ruth says, how often should we have a stool? You should have a stool often enough that you feel that you're not constipated. Constipation are signs and symptoms of cramping and pain. You are not constipated because you have a bowel movement every 3 days. Frequency doesn't matter as much as, are you having pain and symptoms of not having a bowel movement? Now it's a problem. Okay? Did I miss any over on YouTube? B1 asks, how long should I need physical therapy for a neurogenic thoracic outlet syndrome? Everybody heals differently, B1, and there's no hard and fast rules on how long you should do physical therapy. But I would give physical therapy at least a month of consistent treatment. If you're not getting any better, I would consider seeing a different physician or a different therapist. Do not continue with the same therapist if you're not getting results. Okay. Okay, so I want to thank my helper over on YouTube. I do appreciate you helping out and scanning for questions as well as scanning for riffraff. Sam says, I find myself to be hungry just a few hours after eating. Is it because I'm not eating calorie-dense food? That's a possibility. You could be eating calorie-dense food and you're not eating enough. You should eat protein and fat until you're comfortably full, and then eat again when you are hungry. If you are not getting enough nutrition, your body will tell you you're hungry. If you are choosing the wrong foods to satisfy your hunger, then you got to change your diet. I mean, that's all there is to it. Chris asks, does omega-3 bring down triglycerides? Yes, it does. Omega-3s, which are an essential fatty acid, they are actually a polyunsaturated fatty acid, and we should try to obtain those from real foods. We should try to avoid taking supplemental form of omega-3 as they have a chance to be rancid. So they're already producing reactive oxygen species. And so we should try to get them from omega-3 rich foods, which are grass-fed, pasture-raised animals. There's some algae products that are high in omega-3, but relying on ALA as a source of omega-3 is not in our best interest, as the conversion to DHA and EPA are not very good. You're very welcome, B1. Paul says, hi, doc. Doctors yesterday, cholesterol at 6.9. Can you convert that to me? I mean, I know it's high, but can you convert that 6.9 cholesterol to a US standard? Also, let us know what your LDL, your HDL, and your triglycerides are. I have ulcerative colitis. I'm 55. So ulcerative colitis is an inflammatory condition, and likely something that you are consuming has increased your gut permeability. Colitis, itis, means inflammation of your colon, which in your case, it involves ulcers developing, which is not a good thing. So healing that, ulcerative colitis is very high risk for cancers in the future. So it is in your best interest to find out what's causing that. Tallow, he's really acting like a puppy today. Thanks, RM. Yes, I am family practice physician, and I do practice in Iowa, so I'm in the United States. Okay, B1 says, final question. Can you tell me more on magnesium malate? I know I'm a mess. Well, you might think that you're a mess, but I truly believe that you have the ability to heal a lot of these things by changing some of your lifestyle. Magnesium malate is one of the better salts of magnesium, especially that is more easily absorbable. So I'm not sure why you're using magnesium malate, but all in all, that would be a good form of magnesium for many things. You can use a combo of malate, orotate, threonate, bisglycinate. Those are good combinations. Let's see. Akil, I do not know how to answer that question about your whole body, muscle, bones, joints, being osteomyelitis, curable by pills. Again, these are questions that I would probably ask your personal physician. Lion says, have you found a local store or meat market that has beef liver and will combine it with ground beef? I have not. Again, you might want to ask that Waukee butcher. I'm not sure. I've tended to lean toward chicken liver at the moment, But, you know, and it doesn't take a whole lot, Lion, to consume. Oh, Sonia, I'm very sorry to hear about your Crohn's and just getting out of the hospital. We're going to, you know, hope that you get better. I'll pray for you, okay? Thanks for sharing that with us. Yep, that I agree with that. Thank you, RM. I appreciate that. That is correct. What is Crohn's disease and how do you get it? Crohn's is an inflammatory bowel disorder. And usually, I mean, there's a lot of times that this could have some hereditary nature to it. However, I believe strongly in toxins that we take in either through our food, the air, our water plays a role, our lifestyle in general, our sleep patterns, our stress patterns. But my tendency is to always go back to our diet as increasing the inflammation. And by getting rid of things that increase gut permeability, such as grains, that might be a big one for you. Getting rid of all grains, which are very high in lectins. And many plants are high in oxalates and phytates, which are anti-nutrients, and they all disturb our gut lining. When our gut lining is disturbed, it allows things that are supposed to be inside the gut lining or inside the gut to creep into the free space in between there. And that is not good. And that is causing high inflammatory changes to occur in our body. And those are very difficult to treat. Changing your diet is number one. God Eater, I do not understand your question. So let me know. For Crohn's, try BPC 157. I don't know much about that treatment. Okay. Medical questions only, you guys. If you have a question, put a question mark in front of it so myself and the moderator can see it. Okay. Paul, you can, go, use your computer if you want to continue listening, but use your computer or another phone or your iPad or something like that and say, please convert cholesterol of 6.9 to US. So UK to US, and it'll give you the number. So I can help you. I understand that 1.25 is normal, but again, I don't know what your diet is. I don't know what your exercise routine is. I don't know what your medications are. There's a lot of variables, Paul. If you would like to consider a consult, I would be happy to schedule that. Just email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Sissy says, what are your thoughts on hypothalamic amenorrhea? I am nearly 1 year strict carnivore. Were you diagnosed with hypothalamic amenorrhea? So, you guys, there's people that are using a lot of big terms, and I'm going to try to break it down. Our hypothalamus is in our brain, and amenorrhea means without a period. Can carnivore... Okay, let's start from the beginning. What are some causes of hypothalamic amenorrhea? A woman being on birth control pills can shut down our normal hypothalamic pituitary adrenal axis. So where we go from in our brain, the hypothalamus, to the pituitary, and then that tells our adrenals to kickstart, to make DHEA. DHEA makes androstenedione. Androstenedione converts to testosterone. Testosterone converts to estrogens, plural. And that's the basic concept in all people. In females, you're going to get more conversion of testosterone to estrogens. Now, if you took birth control pills, it's going to negatively feedback and tell your hypothalamus not to talk to your pituitary, not to talk to your adrenal glands, because you're giving exogenous, meaning you're giving a pill form of your hormones in order to block getting pregnant, for instance, or to regulate your periods. your diet, if you were anorexic or bulimic, that could also cause your brain, hypothalamus, and the pituitary and the adrenal axis to go kaput. And it's going to take, if you've been a 1 year carnivore, I get it, but it could take more. I don't know how long you had been damaging your body prior to that. Okay. And so it can take time. The fact that you're not having a period is not completely abnormal, especially if you are a person who does not have very much body fat. If you don't have very much body fat, there's no storage area for your estrogens. In your case, it's going to be very important for you to increase your fat intake through animal fats. You want animal fat cholesterol, not plant food cholesterol. And by you telling me that you're a carnivore tells me, I'm hoping that, you're carnivore means you do not eat carbs, and that means you're not eating any plants. Plants have phytoestrogens. Plants have anti-nutrients. And I'm guessing that you know this if you are a carnivore. It might be something for you to maybe try increasing your fat to protein content with your animal fat to 2 to 1. So if you are getting 125 grams of protein to sustain your body muscle mass, you want to also get 225 or 250 grams of fat. You also need to increase your calories. And I say that lightly. You want to increase the amount of nutrients you're taking in. You could be not eating or consuming enough of your dense nutritional foods. And hopefully that makes sense. If it doesn't, or you have additional questions, please comment. Sis says, yes, I was a strict vegan for 8 years. I lost my period since 2018. I'm trying to heal and get my period back. Give it time. You are healing, and it's going to take time. It's just going to take time, okay? You're doing all the right things, but maybe consider increasing your fat. Maybe consider increasing another meal. If you have been a vegan and or anorexic or bulimic, you might want to start with more frequent or, eating more meals a day instead of fasting. If you fast, you might be encouraging your body to continue maintaining this maybe too low of body fat, okay? And I don't know your situation. I'm just trying to give you some things to think about. And if I spurred your memory and you have another question, please don't hesitate to ask. Paul says, I think it's 267. That sounds about right. And that 267 depends on what kind of a diet you're consuming. Also, I don't know your LDL, your HDL, or your triglycerides. So use the conversion, just type into Google, my HDL of blah, blah, blah in the UK is what in the United States? And that would help me out with some more information. Gia says, isn't too much beef high in cholesterol? You've loaded your question, and it's really not a question. You're actually making a statement with a question. So first you're saying, isn't a question, too much beef. Here's what you're saying is, what is too much? Is too much having 8 ounces a week, 8 ounces a day? I don't know what too much is. And is it too high in cholesterol? My question back to you is, what is too high cholesterol, and why are you worried about too high cholesterol? Okay. I think there are some other things that you might need to be worried about, and too high cholesterol, which I don't know what too high is in your definition. I think we need to decipher out what things are, what's going on. If you would like to consider a consult, please don't hesitate to contact me. Thank you very much for the compliment. I appreciate that. There's one to, there we go. Denver says, what time does your live end? I want to listen to you and handle chores, so I know to leave the noise chores for later, like washing dishes. I usually go for upwards to 2 hours, and I stop if there's no questions. I'm not going to keep trying to talk. I have some things that I could talk to you about, but what I really like is to answer your questions, of course. Gia says a diet primarily of beef is what you're eating. Is that too much meat? Is that too much cholesterol? I would like to see your lipid panel and the results of that. I would like to see your insulin level. I would like to know what your thyroid is doing. There's a lot of things that are unanswered that I do not want to blankly comment on, Gia, and I hope that you will understand. Carrie says, hello, doc. I cannot get glucophage in the UK. Looks like I need to replace with 2 products and researching medical grade. Is there anything I should avoid in ingredients researching? No synthetics, etc. Lay down. Tallow. Tallow is my problem child this morning, it appears. Is there anything I should avoid in ingredients? I mean, Carrie, you know, I know you well enough that you're going to look at the ingredients and tell. You might want to consider just simply drinking milk for the lactoferrin or buying a source of lactoferrin if you cannot get apolilactoferrin, which is glucoferrin. So you might want to consider lactoferrin, okay? Or just simply continue doing what you're doing. I think you're doing great, okay? You know, I think that you're on the right track. You're exercising, you're eating a diet that is rich in nutrient-dense foods, and I think you're gonna go a long way in healing. Our moderator asks, how would someone with anemia know how to eat enough red meat without being in high cholesterol? One, I don't know that high cholesterol is an actual problem. I would want to know about the other, you know, I would want to know about their LP little a. I'd want to know about their triglycerides and their HDL and their LDL. I would want to know about their insulin level, their A1C. I would want to know what their CBC looked like. I want to know their iron level, their transferrin level, their thyroid level, their ferritin level. There's so many things. If you would like a list of good labs to obtain, you can email me free of charge. I do not charge. Just email me at ironladydoc@aol.com. I'll send you a list of what I think are pertinent labs that can help you talk to your doctor about getting these, okay? If you're in the United States and you cannot get your doctor to order labs, I would be happy to also order them for you. I have a lab that has a medical director with a license in all states. So he or she, medical director, is signing off on all the labs that are ordered, which is good, and it's in you guys' best interest, okay? But if you are outside the United States or in certain states that I cannot order those labs, I apologize. I would do the best you can with your primary care physician, or finding one that is more in line with how you want to be treated as far as your health. Find that provider and ask them for the labs, okay? But RM, to answer your question, red meat is good for heme iron. That is the absorbable form, the better absorbed form of iron, and that is the one we need. Red meats or ruminant meats are where we get it. What is my thoughts on microplastics? I wish they were not around, and I try to avoid them as much as possible, okay? NJ asks, why would be some reasons people getting a hiatal hernia? One, there could be a defect in the diaphragm when you were born. And that defect is exacerbated when the belly grows bigger in size, okay? And that belly can grow bigger in size during pregnancy or during obesity, and then that can make the hiatal hernia worse. And so what a hiatal hernia is our intestines slipping up through the diaphragm. Okay, it slides up through the diaphragm, usually in a defect. It may or may not cause symptoms of reflux. You might have found it incidentally on an x-ray, but these things usually are not surgerized. You don't do surgery on them unless you are at risk of strangulation, meaning twisting of the bowel, and that can be a danger. I mean, that's life or death, and it needs to be looked into. So finding a good GI specialist to talk you through this is in your best interest. Mobetta, what can be done for HIV-related anemia? Again, I don't know what your definition of anemia is. Many people think that anemia is simply low iron. It may not be. Anemia is basically should be called, I think, iron dysregulation. Iron dysregulation is a better term than anemia, because I think we get a false definition of anemia by thinking that it's just our hemoglobin being low or hematocrit being low, or subconsciously thinking that it's our iron, and then we end up taking iron, and then that synthetic iron makes our problem even worse. So this is a deep problem, whether you have HIV or whoever you're speaking to has HIV or not. You need to look into, is your anemia, what type of iron dysregulation is going on? What states are those that you can't order in? I've tried to look these up. There's like 7 of them, but they're usually on the East Coast, Rhode Island, and I believe New York for sure. 786 says hello, so hello. James says, it's the truth what you're saying. That's why people is off balance mentally and physically. What did I say, James, that would lead you to believe that's why people is off balance mentally and physically? I'd like to learn more. Sissel says, thank you. I was also anorexic. Okay, so you're adding more to our situation, to your situation. That's giving us a little more information. And by breaking that down a little bit more, is that you have, for the 8 years or so that you were vegan and anorexic, you've really put your body at a disadvantage. You're already trying to improve that, which is great. I want to congratulate you on making a change. Thanks to carnivore, you've put some weight back on. And Sissel, a lot of this is not only just the weight is a thing, and I'm happy you're okay with that. But really, it's a lot of it is dealing with the mental anguish and where your heart is that led you into that place in the first place. And healing that little girl in you, I think, is the most important thing right now, and not as much about worrying about your weight on the scale or worrying about what you are eating, or the ratios you are eating, but healing the little girl in you, because somewhere along the line, you've developed some sort of, what I would think with those diagnoses that you gave me, is a codependency. And, somewhere along the line, you might have either been neglected, that's a type of abuse, by some sort of adult figure in your life as a child. And one of the ways that you controlled not either feeling bad about yourself, your shame and your guilt, because whoever was in charge of you, a parental figure, brought you to such a place in your heart that you had to protect yourself. And, that could have been an over-empowerment, where you learned that if you were skinny enough, pretty enough, whatever, it pleased the person that you were trying to gain love from. And so the harder and harder you tried to stay thin enough, exercise enough, eat well enough, stay lean enough, whatever the thing was, there's a tendency that you might have been doing that in order to gain the love that you didn't have growing up, a neglect. It's a possibility. It's a real thing, okay? And it became your one true desire. And somewhere along the line, I want to congratulate you to get this far in your life and to say, okay, none of what has happened to me was my fault. It was the little girl who was reacting inside of me. And so that little girl is still there, and she feels that she needs protection still, and you need to reassure her that no one's going to hurt her, and she can come out and be healthy, and she doesn't need protection, and she doesn't need to please people. And so a codependent person needs to get happy with themselves, find out who they are, so they don't continue to attract what feels comfortable from their childhood. And that comfort could be a person who said, who one neglected you completely, or they gave you bits and pieces of love bombing, I call it, and they harmed you. That's a type of child abuse as well. There's many degrees, there's many variables. It could be too much, it could be under. There's just so much, but know that little girl probably needs, to be reassured. So you need to talk to her and reassure her that everything's going to be okay. You're going to be okay. I'm here now. We don't need to protect ourselves by not eating or just eating non-nutritious foods and starving ourselves to get love and attention that we so desired when we were little people, okay? Paul says, sorry, going to get back to you. Not got the information, the blood test next week. Okay, sounds great, Paul. Sissel says, I try to not count my macros because of my background, but I eat a lot, nearly 25 to 3,000 calories daily because I have extreme hunger due to anorexia brain. You're welcome, Carrie. I eat a minimum of 150 grams of protein and I feel safe with OMAD. Otherwise, I can not stop myself. I need time, even though it's been 1 year. Good for you. You're starting to figure things out. Liesel says, what is the difference between fasting insulin? Thanks, RM. I appreciate that as a moderator. Please thank RM. She is my blue wrench over on YouTube, helping me out. I've missed quite a few questions over there. Looks like if you want to put me down and to use some sort of retaliation against me, we really don't need to have that on our. Back to Liesel's question, what is the difference between a fasting insulin and an A1C? Insulin is a hormone that is secreted from the beta cells of our pancreas. And our pancreas will secrete insulin when it senses that there's blood sugar, and if there's more blood sugar in our bloodstream, more insulin will be needed to bring that blood sugar down. So insulin helps our body become more sensitive to blood sugar. Hold, please. Hey, we need to stop. We got a lot of playing activities and chasing, and it might get a little distracting, so I have to put a nix on that. A1C is a measure of glycated hemoglobin. Hemoglobin is a protein in the red blood cells. A1C is a measure of glycation. Glycation is whenever a sugar binds to a protein. This binding is called glycation. Unfortunately, sugar gums up protein. And in this case, sugar is gumming up hemoglobin. Hemoglobin is being destroyed by glycation. Because if hemoglobin is not functioning well, It doesn't carry very good heme iron, and it doesn't carry very good oxygen. Two very important chores that hemoglobin needs to do, okay? So if you have a high A1C, most likely you have a lot of glycation going on. The only other time that an A1C can get elevated is if the health of the red blood cell, if the health of the red blood cell is extending the life of the red blood cell. So if a red blood cell lasts longer than the average length of time that it usually passes away, 120 days, it is exposed to glucose over a long period of time. And even if that glucose on a carnivore diet is still low, it still glycates, okay? So if the red blood cell is living longer, especially in a carnivore, that red blood cell is exposed to glycation, even if it's a small amount of sugar, a lot longer. So that A1C could be falsely elevated. If the red blood cell is dying faster, then the A1C, hemoglobin A1C, could be falsely low. So if I see a patient who is obese, or they have a ton of hard belly fat, I assume that that person has fatty liver, visceral fat. Visceral fat is very, very dangerous, and it goes up with high insulin. If the red blood cells are not very healthy, they will die sooner, and these people will have an A1C of 4.9, 5.0, and I'm going, what? Something's going on. And then I look at their body habitus and I go, this person has insulin resistance, and that A1C is falsely low. That red blood cell is being destroyed faster. If you wanted to see how accurate your A1C is, just get a reticulocyte count. A reticulocyte count. A high reticulocyte count tells me that the bone marrow is pumping out a lot of baby red blood cells. And if that reticulocyte count is high, it tells me that maybe the red blood cells in our body are dying too fast. They're not living long enough, okay? So a reticulocyte count will help. So hopefully that helps you, Liesel. Let us know. Let us know in your, in the comments, or if you have another question. Sissy says, you understand me deeply from my heart. Thank you so much. I don't know that I understand you as much as I understand the big picture. There are more codependent people on this earth than you would have ever imagined, okay? There's also a lot of narcissists on this earth than you would have ever imagined. And for a codependent person, that I'm assuming you are because of your diagnoses, I sense that you had either a covert narcissist or an overt narcissist in your life that had played a huge role in how you came to be your adult making decisions, or as you aged and the decisions you made. This is a common pattern. Now, not everybody fits into the exact same, the exact same variables, okay? It's not cut and dry. But in the big picture, I just feel that you, because of what you've told me, you had to have been hurt in such a way when you were a child. A lot of these things, could they be learned as an adult? Yes, but usually the trauma bond occurred way, way, way back, okay? It occurred way back there in life when you were impressionable. And they always say between the ages of 18 months and 3 years old, you're kind of in that time period where you're learning your independence. And there's a lot of things that can occur during that time, especially before the ages of 6, where we learn different coping strategies with trauma that we have had. There are certain things that children need. They're growing up. They need, food and shelter, and they need value, and they need virtue. They need all these things in order to survive. And then after about the age of 3, they're supposed to start learning their own identity. And sometimes our parenting skills are very dysfunctional, and then the child is the result, and the child gets the brunt of it. And a lot of these things, Sissy, are multi-generational. Is your parents learned it, and their parents passed it down, and you're just a multi-dimensional child that came from, multi-generational hurt, codependency, narcissism, other personality disorders, but those are 2 big ones. And if I could recommend something, I would recommend that you start looking into codependency. And if you feel that you're that empathetic, you feel the pain of other people, you feel the pain of yourself, maybe even too much, you're very empathetic, and you might lean on the scale toward codependency. And that is a detriment for you in learning about codependency. And you got to study. It's going to take some time, okay? It's going to take some time, but you can get past this, and you can help yourself. But I think you're expecting the physical traits to improve, and you got a lot of emotional and mental traits that need to be healed. And that's those ones that are stuck inside you that you need to reassure that are okay. So again, reading, and, getting in tune with a good therapist that will help with strategies to, I don't want to say fix, to heal you of your codependent strategies that it's not your fault that you had. It was only you helping your little girl survive trauma, and you've learned them into adulthood. Liesel says, what range do you like to see A1C? I mean, a normal A1C, optimal, would be 5.0. But there are, as I've mentioned, Liesel, there are many variables, and I would want to know about diet and lifestyle and sleep and your other labs like your lipid panel, your thyroid. All of these things play a role. By simply just giving you an A1C level, you're chasing numbers and you're not chasing the inner workings of your body. I don't want you to chase numbers. Constantly, consciously one, I have not seen you for a while. Love, love, love. It's good to see you. Thank you for being here today. Okay. RM, did I miss any questions? Chip says, it did for me, had a mom with horrible mental health. I don't know. I'm missing the context to your question or your comment. What do I think about carnivore or keto, very low carb eating style? TL, what I think of it is what my personal, how I choose to live. If you want to say, what are your thoughts about carnivore or keto for me, for you? That's the question. I would say that keto and carnivore have helped heal me in many, many ways, that I don't want to go back to eating even a low carb diet that includes plants. The fact that I feel so good off of all plants, I will likely not go back ever. So that is what I think about carnivore or keto for me. I would be more interested in how you feel about keto or carnivore for you. There are people probably listening that can eat plants and feel fine. And they feel fine in general. And then I'd say, hey, there's nothing to worry about then. But if you're listening to me and you're worried about your metabolic health and you can't understand why you're tired, you're not skipping on down the street and singing the happy song, and you're wondering why you're aging so fast, you're listening because you think there's something going on, there's something wrong, or there's something that can be helped. And I would say that triggering or looking back to your diet is the easiest way for me to do that, because the diet is the one thing that we can change undoubtedly. Chip says, nope, that was past question. Sorry about that. In your experience of people with trauma and addiction, how often do you see people turn around? I'm on my second relapse. I just want to give up. Well, Chip, I don't want you to give up, and neither does anybody else listening. But I think many of us can understand where you could feel so overwhelmed that you want to give up. But just know that the fact that you've actually tried and you've had times intermittently where you were not relapsing, you should pat yourself on the back and tell yourself, good job. The fact that you're relapsing is because something that was a trigger to you, you allow back into you let your guard down, you let your boundary down. And what triggered you in the past with an addiction or trauma, it's something that you need to go no contact with, Chip. You have to completely go no contact. You have to end the addiction of whatever it is, alcohol or whatever drug, or it might be something else. It might be an addiction for a pair of shoes. You need to go no contact with that idea that the shoes are your problem. Okay. I know that you can do it. The fact that you're on here and you're putting this in public tells me that you've already been and trying your healing journey. And that is what's most important. So that's why I think you're not going to give up. Okay. You'll keep going on this journey because you actually want to heal. And many people who have committed themselves to that healing, they don't give up. But it's going to take therapy. It's going to take you figuring yourself out on why your codependency, why your addiction. You got to get to the root cause of what began this addiction or this codependency on something that has brought you into adulthood, still relapsing. Okay? And that takes intensive therapy. But I'm guessing that the fact that you're here and you have empathy and thinking about yourself and wanting to heal, I know that you can. And there is hope for you, okay? So please don't give up. There are very, very good codependency therapists out there that can walk you through and help you understand why you think the way you do, because you know something is wrong. You know that you're turning to an addiction. You know that's wrong, and you can't stop yourself because that is the thing that you feel the most comfortable with. You have used that type of protection over years, and it's something that comforts you when the trauma is brought back to you. And so, one, you have to figure out what is that trauma, where is that bond, and then study and learn why you developed the way you did. Because again, it's not your fault. It is your inner, your soul, your mind, your body, your spirit, the reaction that you took to protect yourself from some dysfunction in your life. Okay? Hey, Brady, thank you for being here. Hey, Doc, keep up the good work. Thank you so much. I appreciate that. I do not know, Jim. I appreciate you with the recommendation for the mental health trauma and MACE energy protocol. I'm sorry, I don't know much about that. I'm probably more along the lines of recommending deep therapy with somebody who is very, very good with helping with codependency and narcissism. Oh, okay, thank you, RM. I appreciate that. And yes, please like and subscribe. If I'm helping you, know that I could be helping somebody else in your circle of friends, family, coworkers. I give you a thumbs up. If you have a question, please state it. I will try to answer as best to my ability in regards to your medical concerns. Lucy says, good morning, Dr. J. Got to catch the recording of this as I slept at 9 hours. Oh my gosh, Lucy, that is awesome. Awesome. Congratulations. Start my classes. I struggle with food addiction as well. I try to eat healthy for the most part, and I just realized how true your words are. I just needed to remove that trigger from my life. I just subscribed. Oh, thank you. Share this, you guys. You know, I am not a psychotherapist. I am not a psychiatrist. It's just things that I have dealt with in my practice for so many years that what I've noticed is that there's a narcissist in every 1 out of 5 people. So it's upwards to 25%, 20 to 25% of the population is at some stage or variable of narcissism. And there is, I think, likely because of the way kids are brought up. And again, we're not talking about new modern stuff here. We're talking about, this could go back to the 40s, 50s, 30s. Okay? I mean, some of you in your 50s listening right now had parents that were born in the 30s and 40s, and they had some sort of trauma bond, and their parents were born in the early 1900s or even late 1800s. So these are multi-generational concerns that's still occurring today. Could it be worse today? It could be worse today because of the things that are going on, and maybe each generation after the first gets worse and worse and worse, or the fact that we have a higher population, that we're just going to be a higher population of narcissists and codependents. But I think in general, learning about these things and knowing about you helps your overall health. Remember, your health is not only mental, but it's spiritual and it's physical. And we don't just try to fix the physical part, the metabolic part, without and disregarding or not taking into account the emotional, mental aspect and the spiritual aspect. It's mind, body, and spirit, okay? And we need to take all of these things into consideration. And I don't want to reduce everything, that if we just fixed your physical aspect, we fixed your metabolics, okay? Like Sissel, okay? Sissy. I'm sorry, you'll have to tell me how you want me to say your name, but if we just say, well, Sissy's going to eat carnivore and it's going to fix her anorexia and it's going to fix her veganism, or the problems that were associated with those two things, okay? If we just reduced everything to working on her diet, we're going to miss the things internally that could get her to relapse in the future. And then she's going to be filled with shame and more guilt, and the cycle's going to return. And how we look at our body is from a trauma bond before. What we eat and how we think about our physical well-being is from trauma bonds before. Same with our heart, our spirituality, our mind and mental and emotional aspect. So we cannot just reduce this only to a physical aspect, which I tend to do because I think if I just get everybody to eat a low inflammatory diet, it's actually going to help with their mental well-being. It can, as long as there is a thread, a tiny little part of that person that is so strong that they can recover. If that person has been beat down so badly that their inner self has not been allowed to escape, or it's been repressed or suppressed or denied, our reality of how we look at things is real, you guys. It's very real. And a lot of times we'll talk to people like Sissy, she's made this public that she was an anorexic and a vegan. Okay? Somewhere along the line, her reality has been distorted. Somewhere along the line, her boundaries have been distorted. Somewhere along the line, she's had a trauma bond. Somewhere along the line. And she's developed protective mechanisms. And me simply recommending a carnivore diet to her is good, but it's disregarding the other things. And if I don't mention that to Sissy, then we got a problem. I haven't helped her. Neither of you guys. Not that that's my only goal is to help her. My goal is to give her information so she can try to help herself. Getting a therapist, learning about these things. She maybe didn't even know the words. Yeah, you're right. I looked up the definition of codependency, and that sounds a lot like me. I'm not even me. I don't even know who I am. I'm not me. I'm the addiction person over here that is relapsing and now shaming and guilting themselves and say, I can't take it anymore. Well, that's the inner person. So it's Sissel. C is a Turkish letter like ch. Oh, chisel. So but Sissel is okay too? Okay, chisel? Is that how you want me to say it, chisel? Okay. I'm sorry, I want to get it right. Anyway, yeah, I guess, no, I'm not a trained therapist, and I think everybody needs a trained therapist. I think therapy is needed by a lot of people, but some of you right now want to maybe just get definitions. You want to know, hey, I think there is a problem. And yeah, it's deep, you guys. And the more and more we know definitions of things, but honestly, the first question you need to ask yourself, or the first admission, is that something is wrong. I've lived like this for way too long. Something is wrong, and I need to find out what it is. Admitting that something is wrong is step number one. And then not suppressing it or repressing it or distorting your reality anymore and saying, you know what, I'm fine. That's denial. You just told me that you weren't fine. You know something is wrong, but you don't really want to look into it. And many people deny getting help because they think that they've coped and they have a good strategy, but yet something inside of them is saying something is still wrong. I can't control it. I'm like a roller coaster. I can't control it. You were never meant to control it. That is a tactic of protection that happened to you a long time ago. And so you have to go back in time and figure out what that trauma is and why you do the things that you do now. Because in reality, if you haven't had kids yet and you're planning to, you're going to end up passing those exact same techniques down to your kids. And if you truly want to protect them from whatever's going on, you need to learn about functional parenting and not dysfunctional parenting, because you are the way you are because of some sort of dysfunctional parenting figure in your life. Okay? I don't know what that is. It's a deep dive. Okay? It's a deep dive. Gia says, thank you for such amazing information. You're very welcome. TL says, any carbs make me crave carbs, so I'm pretty strict carnivore too. The mental clarity, disappearance of depression and brain fog, and overall better health will keep me carnivore. See, TL, that is an awesome testimony that many people need and want to hear. And, I don't know how long you've been carnivore, but I'm guessing that you feel as healthy now or better health than you've ever felt in your life. And you need to share that with people. I need to get autophagy on carnivore, so I think alternate day carbs on deficit works best for me to trigger autophagy. Autophagy occurs when we are in ketosis. Autophagy occurs when we are fasting. Autophagy does not occur when we are eating carbohydrates. So I don't know if you are confused or you have some sort of other technique that you are using, but I think the facts are the facts that ketosis and fasting are the biggest ways to get into to lead to autophagy, which is cellular cleanup. It's basically maid service coming into your hotel room. Your hotel room is the cell, and the maid service is the cleanup situation, okay? That's autophagy. Stop. Mike is asking about issues of autonomic dysfunction and frontal lobe epilepsy, tapering off of methadone. Those are things that I have very little experience with, so I'm not going to be able to answer your question. Good morning, Lorraine. I don't know where you're listening from, but it's morning where I am. Scrapman, can therapy come from within, or is it only accessible looking elsewhere? That's a good question. It is hard since if you are a person who has been holding in and repressing or suppressing or denying or living in a different reality, it might be hard for you to do it yourself because you may not know what you are suppressing, repressing, denying, blah, blah, blah. You may not know. And could you do it on your own? You could watch videos on YouTube about codependency. You could read about learn about narcissism through videos. There are so many YouTube videos on codependency and narcissism that you could spend the next 100 hours and not run out of information. And they are very, very good at teaching you about you. And then you might get books. You might read books about these things. You might hear about an author from one of the videos that you're listening to, and you need to start putting the dots together. You'll start connecting the dots and things that you had been repressing or suppressing. If you repress something, it is very hard to yank out of you. If you've only suppressed it, it's easier to yank out, okay? If you've repressed something, your healing is much, much harder. And that's going to take a very skilled therapist, I think, who can help yank that repression out of you or dig in deeper so it comes out. But suppression might be a little easier to deal with, and maybe you could heal on your own, but it's going to take you deeply engaging in learning about techniques, okay? If you don't know your diagnosis, heck, that's what AI is for. Type in and say, I listened to this lady on YouTube on Saturday, and she was talking about a codependent. Am I codependent? And then put in like some symptoms. I don't know who I am sometimes. I don't even know what I want sometimes. I don't think I need anything sometimes. I feel like I just want to help people and more than I want to help myself. Or, gosh, I'm just so I feel sorry for everybody. I cry easy. Those symptoms might tell me that, hey, I might be codependent. Is that true, AI? And then AI will spit out something, and then you'll come up with another question because they brought something to your attention, and on and on and on. So yes, you could do this on your own. Yes, the answer is yes. So, okay. Angie says, I put my kids in counseling when I was in active addiction. Good. Angie, did you go to counseling? Scrapman says, can therapy access by self? Yes. In fact, Scrapman, you could do it online. There are online therapists. So just look or listen for, people, maybe they're the YouTube speakers that you find that are helping you decipher things. And maybe you sign up with therapy with them if they offer that. Al says, autophagy does not happen when IGF-1 and mTOR are elevated, nor do they occur when insulin is elevated. So anytime we eat, whether it's proteins, fats, carbs, mainly carbs, elevate mTOR. They also elevate insulin to high levels. Insulin like growth factor 1 and insulin run side by side. So you're thinking along the lines, yes, autophagy cannot occur when IGF-1, mTOR, insulin are elevated. It only occurs when they are low. So even exercise will stimulate mTOR. So you're gonna have to be not eating or not eating carbs, which is ketosis, okay? And then fat would be high. So no exercise, no increased insulin, will decrease mTOR, will decrease IGF-1, will decrease things going on in your body metabolically and allow autophagy to occur. And thank you for that, for bringing that up. Only Jerome, the gym is my therapy. Good, awesome. I think that's a great form of therapy as long as it's not in excess, because some people use it to addicted to exercise, and then that can be a problem, and that is your coping skill. That might not be therapy at all. It might be your protective mechanism. P-Dub says, I had 2 strokes a few years back, but a year ago I developed shaking in my head and hands plus tingling from shoulders to hands. Severe. Is it nerve damage? Well, I don't know if it's nerve damage, but it sounds neurological, right, P-Dub? So have you talked to your doctor? Have you had extensive labs done? Those are questions that you probably need to speak with your primary care physician or see a neurologist. I would get a very good set of labs. If you need help knowing what a good set of labs are, email me at IronLadyDoc, I-R-O-N, Iron Lady, L-A-D-Y, Doc, D-O-C, at AOL.com, and I can give you a good list. I am family practice. Ice Cat says, that's true. I hate how real AI can get. They're collecting evidence, aren't they? That's for sure. It is us programming AI, okay? Josh says, how can I focus on something like studying and not get distracted all the time? Get rid of distractions, okay? Get rid of your phone, put it in another room, put it in your car outside where you're not gonna go after it. Get rid of the distractions, which is usually your computer and your phone. Get rid of them. Take time for you, breathe. do, one of my favorite things is the 5.5 protocol, where you breathe in through your nose 5.5 seconds, you hold at the top, and then you release 5.5 seconds. You try to do that for a minute or two. You're trying to get 5.5 breaths or 5 to 6 breaths per minute of purely breathing in through your nose, 5.5 seconds in, 5.5 seconds out. And that helps to calm you, and it helps to increase parasympathetic tone, because most people who are distracted have high sympathetic tone. Okay? Okay. Nick says autophagy happens when no exercise. Yes, because when no exercise, there's no mTOR. mTOR is going to come down when you're not exercising. So people who are exercising extreme ways of exercising, their mTOR stays elevated. You cannot go into autophagy with chronic exercising. You have to take breaks in order for, and people who constantly are running or training for 100-mile races or whatever it might be, they're doing a lot of cardio. They're not taking breaks. mTOR stays elevated and autophagy cannot occur. They got a lot of inflammation and reactive oxygen species, more so than they need. And autophagy cannot go and clean up things. So when you're not exercising and your mTOR is low and your IGF-1 is low and your insulin is low, you are doing cellular cleanup. Okay? I hear your point, and I'm not sure that I can get on board with the carb thing. And that, again, if you enjoy consuming carbs and you and your body is different, and even metabolically, I mean, what is a low enough mTOR so we can get into autophagy? I think an adequate insulin level that is normal is an insulin level that's between. You cannot maintain a level of 3 to 5 if you're consuming a lot of carbohydrates. Okay, let's see. Am I missing anything over here? Jill says, you are so right with your words. I also diagnosed with narcissism and other mental disorders. I just want to hope that my period back with carnivore diet, I'm just 26. Whether you have your period or not, it's chisel. It doesn't matter if you're worried about being pregnant, as long as you require you to, or to have a pregnancy is not required to have a period. Okay? There are many patients in my practice who got pregnant and did not have their period. You're very welcome, Josh. What's the best workout routine you would suggest? The one you will do, okay? But I think resistance training and HIIT are better than anything else, okay? With that. RM, that's okay. I think it's because of the weather in Iowa. It's cold and I think the reception is a little bad, but I'm trying to keep up with you and make sure that you're not having to do all the work alone. So I do appreciate you. Let's see. Migraine, Dr. Jensen, you so skinny. Yeah, my face is pretty skinny. Maybe you don't know, but I was, in my previous life, I did bodybuilding, and there was a lot of up and down with dieting. And that can be a problem, the loss of fat pads, especially in your face. I am not a big person. I would never claim to be a big person, but how we look at ourselves, and you might say, I'm so skinny. I don't want to be too obese. I think there's a and that we are able to feel good about our. You are right. Women do a lot of up and down training. I think I understand, but I'm not sure. Okay. Protein is the strongest breaker of autophagy. Can you elaborate on that? Because I'm not able to go to the Nature reviews, the molecular cell biology. Can you break that down for us? Help us out. Yeah, you're welcome. I wasn't sure I quite got it. Maybe I didn't even know it, but thank you. Okay, did I miss? Okay. What would be the order with training to get autophagy? Eat high protein so you can recover, train to use up glycogen, then fast. Ooh, that's a deep, and Nick, that's kind of a deep question. I don't know if there's a true answer, but just if you just look at it in general, okay? Autophagy is occurring fastest when we are fasting. So not eating anything causes the fastest entry into autophagy. If we are in ketosis, meaning that diet is low in carbs, very low in carbs, usually moderate amounts of protein and high in fat, we will also go into autophagy, but maybe not as quickly and maybe not as deeply as fasting. So I don't say completely eat high protein diets because you might miss enough fat. And are we getting too much protein or just enough protein? Under protein? What is the true definition of the correct amount of protein? That is a deep question, okay? If we were to overeat protein, that protein is going to give us blood sugar as well, especially if we are eating fake protein that's been processed in protein powders. But if we raise amino acids, we are going to spike blood sugar. Not as much as a carb, but yes, we will. That spike in blood sugar will spike insulin. If we go into our training session and we are fasting, we should resistance train first to use our glycogen stores and then do some sort of cardio after. Do I recommend extensive cardio? No, I don't, because I don't want constant mTOR. mTOR we need to grow, but I don't want to be overgrowing things I don't want to grow, like cancer. High mTOR all the time is high risk for cancer. High insulin all the time, growing hormone causes all things to grow. Causes your muscles to grow, your everything, including cancer. So if you're only eating protein, expecting not to have high blood sugar, you could be missing the boat. Because if you're only eating protein, that is going to convert to blood sugar. You need blood sugar. You only need about 5 or 6 grams or 4 or 5 grams. We overconsume carbs. Our body can survive on 5 grams of sugar in our bloodstream. Okay? Shirley says, shalom and thank you, Iron Lady. You're very welcome, Shirley. Elroz, again, I appreciate your points, but at this point, I think we're going to have to agree to disagree, okay? But thank you. Josh says, right now I've stopped my studies to watch your live. And Josh, if I remember correctly, you're in medical school or residency, I can't remember. Joel uses high protein, low fat for his diet. And that's what makes Joel work the best. So good. I'm glad you know how your body reacts. Lord asks, do I believe in the use of peptides to accelerate weight loss, specifically fat, while trying to gain muscle weight? Do I believe in that for myself? No. Do I believe in it for you? From my perspective, no. Joel says, cardio in the morning on an empty stomach burns fat, not muscle. I would agree with that. I'm living proof of that. That's how I got ready for bodybuilding shows. Morning cardio on an empty stomach was the best way to have empty glycogen stores right when I wake up and start digging into fat. The fact that I had fat on my body preserved my muscle. It was at the end where the fat goes down so low that your ketosis is starting now to dig into muscle and break it down for energy. So there's a fine line, but yeah, doing morning cardio, as long as you got fat, you'll preserve your muscle. You got to lift weights to preserve your muscle too, just so you know. Box jumps equals testosterone naturally. I think any type of HIIT, high intensity interval training, will naturally increase testosterone, but good job, thank you. Let's see. I think my moderator got a little behind. Good job, Joel. I appreciate that. That's a great testimony. Thank you. Hi, Josh from South Africa. I appreciate you being here. Am I missing anything over here on Instagram? I am live on Instagram and YouTube right now. Joseph says he's benefited the most from fasting, and it's helped cure his diabetes. Awesome. Congratulations, Joseph. Joseph no longer has diabetes. What would be the shortest fasting window of fasting after cardio? It depends on how fast your insulin level comes back down, how insulin sensitive you are. You know, a lot of times when we eat anything, insulin can stay elevated. It usually stays elevated for 4 to 5 hours. I mean, especially young athletes, especially young male athletes, their insulin can spike up and come back down more rapid. Others, I mean, I have seen where insulin stays elevated for 10, 12 hours, even up towards to 14. So that is not a good sign. That is a sign of insulin resistance. My Greyhound asks, why you iron lady and not selenium lady or magnesium zinc lady? Well, the iron was not because of the iron, the mineral, the iron on the periodic table, or magnesium or selenium. It was for lifting. I lifted weights ever since I was a little kid, from high school, junior high onwards. And so that's where I got the iron. So lifting heavy iron, Iron Lady Doc. That's where I got my name. Back in I don't know, whenever the computer came out, whenever AOL came out, that's how long I've had my Iron Lady Doc. Cyber says, I think high fiber is good for your guts. I would disagree. Fiber is a plant. Plant causes gut permeability. It also decreases the absorption of all of your amino acids, your B vitamins, your zinc, selenium. Did I say iron? Did I say anything with a positive charge on it? Magnesium, calcium? Yeah, all of those. Yeah, fiber is, if you're eating a high carb diet, Cyber, then yeah, go for it. Eat some more fiber. If you're on a carnivore or ketogenic diet, fiber is just one more plant that causes gut disturbance. So you've already got gut disturbance if you're eating carbs, so go for more fiber. No, I'm Indian and I'm a school student. Okay. All right. Tony says NAC and glycine is helping their lungs and their autoimmune condition. Why do they have autoimmune conditions? Why are you taking something for your autoimmune when something that you could have removed was causing your autoimmune? That's just my suggestion. Have you been in the iron competition? Sizzle asks. I don't know what an iron competition is. Was I in a powerlifting competition? No. Bodybuilding? Yes. You guys over on Instagram are acting really shy today. You're usually the ones that are overcoming, but you must be loving all the questions on YouTube. Cyber, I cannot understand your something about lifting weights and pain. I don't understand your question. Fish like tuna, mackerel is good for your body as long as it's not overdone and full of toxic heavy metals that fish love to take in. I know that tuna and mackerel are smaller, so are sardines. The smaller the fish, I think the better. I tend to like sardines and tuna. Do I do them on a regular basis? No. I choose ruminant red meats. Yes, I am a doctor. Joel, everybody and their mom is an athlete these days. I hope so. I hope that is the truth, that people are athletes. Well, Charles, that's kind of a deep question in regards to your iron tablets. Iron tablets are non-heme synthetic iron that nobody needs. They need heme iron from ruminant red meats, but something is causing a problem with your iron status, and that needs to be figured out first before simply taking a synthetic non-heme iron that we cannot barely absorb, maybe 3%. So something could be going on with your gut. Something could actually be going on with your vitamin A, your copper, which is driving iron to be stored in the liver. There's a lot of things, Charles, that could be going on that I would probably need to have a consult with you, go over your labs, your extensive labs, and figure out what it is that you're eating, drinking, how you're sleeping, all those things. Sizzle says, I have to start isolated cancer treatment again. Isolated cancer, okay. And have some surgery. I'm told side effects will be better than they were 30 years ago, but wondering what to expect. That's a question I cannot answer. I would talk to your surgeon. Cyber says, I'm experiencing a lot of issues on my skin, like eczema, small rashes, which are itchy. I would do an elimination diet of ruminant, meat, salt, and water. Elimination. Okay. Joel says, I know bodybuilders who now their body doesn't metabolize fat so good, too much steroids in their 20s. They hairless, they look good 20 years ago, but now they are all messed up. Yeah, I mean, their skin ages so fast. But again, Joel, those people, your friends or bodybuilders, made decisions during that time, and they got to live with them. And now, you're seeing the repercussions, and likely they are too, but taking it back and coulda, shoulda, wouldas don't work. You can't take back your past. You can only move forward. Doc, do you recommend 2 grams per kilogram protein? It depends on what you're doing, okay? How old you are, It depends on if you're a man or a woman, if you're exercising, not exercising. I mean, there's a lot to go in it. So to blindly say I recommend 2 grams per kilogram, or a pound of protein, or excuse me, a gram of protein per pound of body weight in America, that would be too easy to say. But I think if that you're exercising and you're lifting weights, I think it would be a good idea to get a gram of protein per pound of body weight, or ideal body weight, I should say. So if you're obese 300 pounds, no, I don't think you should be eating 300 grams of protein. Okay, thank you, RM. I appreciate you. Do I charge for, goodbye, RM. Do I charge for my consults? Yes, I do. Rose says he's got, or she has recurring pancreas flares and two-day episodes. I'm not sure. Acute pancreatitis. I have severe upper abdominal pain, and I cannot stand or sit. So you need to see your doctor. My specialty is family practice. Yes, you do need to get to the root cause of your pancreas, besides just taking pancreatic enzymes. Okay. I'm trying to read through the questions. Dr. E, Doc, how much fat and protein? Again, for me personally, I like to get a 1-to-1 ratio. Maybe even sometimes, depending on how I'm feeling, I might go upwards to 2-to-1 ratio of fat to protein. Again, it just depends on you. It's hard to give a blanket statement on how much protein you should be getting. But again, if you're lifting weights and exercising, you need enough protein. You need enough protein for muscle strength and building, as well as bone strength and building. And you need adequate amounts of fat, especially for your hormones. So don't neglect your fat. Fat will not make you fat, and fat will not clog your arteries. Forever Cowgirl says Dr. J's consults are worth doing. Kudos to Dr. J. Oh, thank you, Forever Cowgirl. I appreciate that. And kudos to you as well. I appreciate it. Thank you for the kind words. My A1C was 5.2. It says 1910. I'm 37, healthy weight. My doctor says that's good, but she's kind of a basic gal, and I don't care what the standard or US sets as a goal. What do you think? Well, at 5.2, I like that number, but I don't know if it's falsely low. I don't know anything else, so I would want to know more information before I could give you my thoughts, so to speak. But just looking at the number in general, that is a good number. I don't know why, Rose says, I don't know. I don't drink. I don't know why I have recurrent pancreas flares. Yep, you need to look into that. Errol, I would have to look into more things than giving you a blanket answer on your headaches. I apologize. Yes, fat for your hormones. I agree. Per kilogram of body weight? No, I'm in America, so I was going by pounds. So 1 pound per, 1 gram per pound, which is which would be 2.2 grams per kilo. All right, thank you, says 1910. I got Ben Bickman's book yesterday, as you suggested. Oh, good. What an amazing book. I learned a lot from that book. I've read it multiple times, but the second and third times around, I only read what I highlighted or underlined. So I didn't read it word for word the second and third time through. Monkey Business says, started getting elevated liver enzymes back in the 2000s. You need to look at your iron levels. You need to look at your thyroid. There's a lot of things. I mean, fatty liver is the first thing that jumps to my mind. So getting an ultrasound of your liver, getting an insulin level and see if it's elevated, you likely have fatty liver. That can raise your liver enzymes. What about your medications? Are you taking any medications or eating any particular foods that could elevate your liver function? Monkey Business, I guess I wouldn't know about the anthrax connection, but thank you for sharing. Why do I feel so old after drinking and smoking? Probably because you are old from drinking and smoking. Yeah, toxic exposure on many bases. I mean, we just don't know where. You know, if you were in the military, thank you for your service. Oh, for myself, Dr. E, it would be 2.2 grams of fat per pound of body weight and 2.2 grams of protein per pound or per kilo. Sorry, I'm getting it mixed up. I'm in America. So it's going to be 1 pound or 1 gram per pound of each of those. I do a 1-to-1 ratio. If not, I'll do a little more fat. So I could go upwards to 2-to-1 ratio, 2 grams of fat per pound in the fat category to protein. Kathy says, what magnesium do you suggest to lose weight? I don't suggest any magnesium to lose weight. Okay, you guys, we've been talking for a couple hours now, and I'm going to call it quits. I will be back, Lord willing, tomorrow, Sunday, at 10 a.m. Central. So 10 a.m. Central, I'll be back live on YouTube and Instagram. So if your questions didn't get answered, come back tomorrow. If you haven't already, please like and subscribe. Please share. If you feel that some of the things I have said would help somebody you know, like a friend, family member, or coworker. Okay? So you guys go ahead and you have a great Saturday.